So, are healthcare policies really protecting everyone equally? Well, the Educate Act's impact on Black women's health tells a different story. When I first saw the headline that congressmen had introduced this new bill, I experienced a wave of emotions. From annoyance that DEI was once again on the chopping block, to anger that my predictions were correct that healthcare would be next after the affirmative action ruling, to fear about what this would mean for my health as well as the health of other BIPOC folks. I knew this was coming as I've been researching how implicit biases among healthcare providers impact BIPOC populations, and the findings have been, in no certain terms, unsettling. Even more unsettling is that the Educate Act will only further limit the discussion of biases in medical education, moving us backwards rather than forwards. But let me make this very clear, if I haven't already. This isn't just a policy, it's about real lives and real health outcomes. This is why my mission at Enhance Black Women's Health, to empower healthcare providers to recognize and address their implicit biases, is more important now than ever before. Because these two men who introduced the bill into Congress are not members of the general public, but physicians. Physicians introduced a bill that is not only an attack on diversity, equity, and inclusion, but also an attack on Black, Indigenous, and people of color. By limiting DEI efforts, the Educate Act's approach could reinforce unconscious biases rather than dismantle them. Unconscious, or maybe conscious, biases led to this bill being introduced into law in the first place. Unconscious biases lead to misdiagnosis, such as the misdiagnosis of Jessica Petway, a beauty influencer who died of stage 3 cervical cancer after being misdiagnosed with fibroids. We also know that unconscious biases can lead patients to underutilize and forego medical care. This is important in cases like Jessica's, where a timely diagnosis can mean the difference between life and death. How many lives could have been saved if patients received timely and quality health care? Therefore, the Educate Act isn't just alarming, it's a direct threat to the health and well-being of BIPOC populations. Riddle me this: how can we claim to advance healthcare when ignoring the biases that skew it? If you're as passionate about equity in healthcare as I am, join the EBWH Community newsletter at ebwhcommunity.com, and let's make healthcare inclusive for all.
Subscribe and hit the notification bell to stay up to date on our latest videos, and together we can enhance Black women's health and create a better future for us all. Enhance Black women's health. Subscribe now.